learning yourself what the registrar's experienced previously and where they're at with this visit, how they're feeling about their work and the practice that they're in. You need to explain the nature of the running of the ECT visit. You need to be really clear with them that you're there as a fly on the wall to observe, and unless the person has walked in clutching their chest with pain, sweating and about to go into VF, you are not going to say anything. You're just going to let it run, and then afterwards you'll talk about what happened. So they need to be really clear. It's their consultation and you're just watching. Check the practicalities, so the timing, that there's spaces between consultations, that you can have time to chat. Ask the registrar what they'd like feedback on. Often is, as my son would say, an awkward silence, because they'll often say, oh, just everything, which means you need to drill down and tease out, well, what do you mean by everything? What sort of bits are you really happy with? Which bits are you a bit uncomfortable with? How's your timing going? That's a really common one. And then actually observe your consultations without interruption. Give them a few moments. I often suggest they write up their notes so they can reflect on what they've done and get themselves in order, and then you can go into the feedback phase. The registrars ideally would think about, yep, this is what I've learned from that discussion and this is what I'm going to do in the next consultation, and practice something. So 2 colleges, 2 different types of forms, which is always a little bit tedious, but in your pack, if you'd like to pull out the AKRAM form first of all, that's a separate page. That's their new 2013 simplified version. And there should be 4 or 5 areas they want you to comment on. They give you an assessment scale from not observed, unsatisfactory, borderline, satisfactory or excellent. And separate to that, they give you a rubric, which you've also got in your information, which is a 4-page document on behavioural characteristics to watch for to decide which area the person's working within. So if you look at, say, communication skills, which is a big one, you'll see, going from left to right, the minimum requirements, and then over to the right-hand side, the excellent doctor who has very highly developed communication skills, and the sort of behavioural characteristics that you'll be able to observe. And it's very much into being able to give a name to what it is that you can see in front of you. The RACGP form, which you also have, has a more simple approach. They look at the 5 domains of general practice, and we have selected to look at an efficiency model where you look at do more of, and then do less is a very safe way of helping people modify how they're consulting. So when you observe a consultation and you see that someone's spending 12 out of 15 minutes looking at the computer, that's an example you can talk about and feed back, and then that might be something that's a concrete one they're going to do less of next time. Consciously thinking about some behaviour they're going to change.